Hey friends, I hope you're having a fantastic day, and I am filming from New Mexico. I'm out here helping my friend do some video work, and before the week got crazy, I wanted to reach out and talk to you about SIBO and emotions, small intestinal bacterial overgrowth, and the emotions or the emotional instability that it can create. This whole month we talked about SIBO. We talked about how SIBO affects your mechanics or your joints, how it affects your biochemistry like your hormones, even other organ systems, the interrelation between organs. Today, let's talk about the emotions, and let's finish it up by talking some of the simple strategies, some of the herbals, the things that I incorporate with my patients to help them process SIBO out of their bodies and help their emotions. So first off, in Chinese medicine, I want to let you know that each organ is supposed to process out a particular emotion. Each organ has an emotion it processes. The health of the organ determines if you process out an emotion very well. Does that make sense? So blood flow to the organ, muscular contraction within the organ, acupuncture meridian feed in and around the organ, and even nerve feed or neurological connections to the organ determine how strong or healthy the organ is. If any of these functions are hindered, the organ will not process the emotion that it was meant to process. Does that make sense? So if you have anything blocking these functions, such as SIBO, or the toxins it gives off, your small intestine will not process the emotions it was meant to process. And those emotions in the small intestine are can't figuring things out, can't process efficiently things that come to you, the stress or the emotional traumas that come to you, feeling up and down, feeling abandoned, lost, or vulnerable. Those are all emotions that your small intestine are there to help you process out. And if you have too much toxins from SIBO, it can keep you from processing out those emotions efficiently. So you have high toxins from SIBO causing this emotional instability, and there's other aspects of it. SIBO, when it gets in high toxicity, can make your body go into fight or flight or freeze mechanism. Why? Your body is all the time trying to create balance. Does that make sense? Your body is a constant adaptation machine. You are trying to create balance every day of your life all the time. So if you have an infection that's heavily being grown or reproduced in your body in a particular organ, your brain knows that it has to produce white blood cells, red blood cells, has to create a fight against it. So what does it do? Increases your cortisol, increases your adrenaline. It turns on the stress mechanisms of the body. So it activates the hypothalamus within the brain, which tells your thyroid, let's produce energy to go fight this infection. And then your adrenals have to pick up and help out by producing more adrenaline to help fight these things that are going on in the body. So they can affect your blood sugar, affect your insulin levels. Your biochemistry can be shifted by SIBO. And when hormones are shifted, what does it produce? An effect on your mood. Your mood can be affected by what's going on in your biochemistry within your gut. So yes, SIBO can create effects on your emotions and your mental processes. Never forget that. It can. So you have SIBO affecting your fight or flight response, affecting your adrenaline, testosterone, estrogens, your cortisol, your insulin. All the stress glands can be affected by a chronic infection. So if you have mood being changed, being altered, know that it can be repaired. Again, and there's another aspect of serotonin and dopamine and interrelated to your stress hormones. Your gut helps you produce serotonin, which is the hormone that helps you feel happy. Now, if their gut is getting overwhelmed with SIBO, it can produce toxins that get in the bloodstream, can get up to the brain, go past the blood-brain barrier, and then affect how your body does what? Produce and metabolize dopamine. And dopamine makes you feel pleasure. So individuals with SIBO, chronic infections of SIBO could actually feel less happy and even overall less pleasure, not fulfilled, not fulfilling the direction in their life. So they have to do what? Get more of a dopamine hit. So that can turn into more sugars, more carbs, more starches, more alcohol, more tobacco, more recreational drugs. Those things help you increase dopamine. They make you feel good with SIBO because you are having too much toxicity within the body and the blood. And so the body wants more dopamine to help you feel more pleasure. You want to feel happy. So it's very hard to do that when you consistently feed the SIBO with foods that make it grow, like the starches and carbs and the sugars. So that's the effect, guys. That's what happens, and then this will make your mood go way down. You'll feel less pleasure and less happiness. So that's the one aspect of it. And this is the reason why you will see things like an individual that has SIBO or chronic infections needing SSRIs. SSRIs are serotonin reuptake inhibitors, which means if you don't produce enough serotonin in the gut, the body feels kind of starved. And any serotonin that you have available that stays within the nerves, you want to keep to make you feel happy. That's why the doctors will give you an SSRI to make you still feel serotonin and feel happy, because you have a skewed or an imbalance within your gut. So if you clean out the gut, your serotonin levels can do what? Balance, maintain balance. Get the methylation, get the liver cleaned out, get the stomach cleaned up, get the small intestine cleaned out, and you'll start to have normal serotonin levels. Now, with dopamine, you'll see that individuals do want more of a hit. They'll turn more, again, to tobacco or alcohol or things that can actually skew or raise their dopamine effects, but skew the rest of the biochemistry of the body. So we want to be able to look at all aspects of the serotonin and the dopamine and the mood, and know that it's related to any type of SIBO if you have it. So if you balance the SIBO, you'll balance the serotonin and the dopamine, which will help your mood, help you feel more happy, more pleasure. All of these things can be affected and benefit if you get rid of the SIBO. So now we see all of these effects from SIBO on your mood. Another thing is the emotions. How can you help with emotions? Well, we're going to talk about what we can do to help clean out the SIBO. But with small intestinal health, we want to see that if it affects the way you feel lost and vulnerable, some of the ways that I see with my patients to help them effectively is to help them with certain emotional clearing techniques, such as EFT, Emotional Freedom Technique, that helps tap emotional points, helps you perform certain humming and additions within the brain to get both sides of the brain to be activated while tapping the meridian systems and going through the emotions of the small intestine. What makes you feel lost? What makes you feel vulnerable? What makes you feel up and down? What makes you feel that you can't figure things out? Take that first thought, ponder on it, think about it, see what in the past has come up in your life that makes you feel this way, and start tapping the points and doing the process from EFT, emofree.com, an EFT technique. Search it out, check it out, start doing the technique when you're thinking about these emotions. The next thing I try to tell my patients to try is brain spotting. Brain spotting is almost like EMDR, but you can go through the emotions with your therapist and perform brain spotting by talking about these emotions or the events that make them come up in your body. I also like to use NET, neuro-emotional technique, which any good chiropractor or kinesiologist can perform on you, neuro-emotional technique. I love acupuncture. I practice acupuncture in my office. I'm certified. Acupuncture will release the emotions, guys. It will get these things flowing. Find a good holistic practitioner, one who does some Chinese medicine. I'm a Chinese medicine man. I love it. Try these techniques out. When you start to unravel the emotions, and now we start talking about unraveling the biochemistry in the gut, then your body can start processing hormones, the hormonal imbalances from the stress that SIBO puts on your body and on the gut, and you'll start to see your body to release those emotions. You'll start feeling less lost, less vulnerable, having more direction in life, and less up and down. Yes, your gut can affect the way you think. What you eat can affect how you think. Do never forget that, okay? That's a corny line, but it's true. So what do? Now, guys, I wrote it on the post. Some things that I suggest with SIBO chemically is, I put it on a previous post, it was like a small graphic, but I say stop the dairy, stop cow dairy. Reduce your grains, I say eliminate grains, eliminate refined sugars, processed carbs or starches, get those out of your diet. And I also say increase green juices, get some greens in your gut, start feeding it with nutrients and vitamins and minerals. I also tell the patient, if you are having SIBO in the body, you want to be able to find a good multivitamin. You want to be able to start a recommendation from a good holistic practitioner of maybe a good vitamin and mineral regimen to help you with the overall organ health within the body. Check out the last post. It has a good list. Those are some of the simple things I say to eliminate, to stop feeding the small intestinal bacteria. You don't want them to overgrow, so please eliminate those things out of your diet. When you heal the SIBO, you'll be able to eat some of these things in the future, but not right now. Don't feed it the carbs. So the other thing, I list from Supreme Nutrition Products the 3 major ones that I find in the office. I probably repeat myself, but guys, look on their website, check out these supplements. You don't want to take all of these at one time. Take them one at a time, or find the one that resonates with you and start off with it very slowly at a small minimal dosage, and then work your way up to the dosage that's on the label or on the website, because you want to make sure that it helps you do 3 things. It helps you what? Go to the restroom well, sleep well or have a good night's rest and give you energy. If it creates lots of bloating or discomfort or makes you feel uneasy or feel agitated, discontinue that product and try the next one. Always ask the advice of your holistic practitioner. And if you have children you want to try to give these herbs to, or if you're pregnant, then always ask the advice of your primary care physician. But these are the three. I talked about neem, which is Malia Supreme, Chinese coptics, which is Golden Thread Supreme, and Morinda Supreme, which is Noni. Now choose one of them. They work really well in clearing out the SIBO. If you go up to the full dosage, I see people that work on this for 6 to 8 weeks, and they do this constant influx of this herbal or this spice, and it actually will start cleaning out the infections. You may want to switch after 2 months. That's about the normal I see. Also, too, you can actually try other things like bone broth or collagen. You can try to start healing the gut lining with collagen or bone broth. Now, glutamine can help, but if you have problems with anxiety, high amounts of glutamine, like a scoop a day on an empty stomach in the powder, can make you have some agitation because it can turn to glutamate. But if it doesn't, use glutamine. It's a really good product to help heal up the leaky gut symptoms. You can also use butyric acid. Butyric acid also helps clean up and heal up the gut lining. But if those bother you, try the bone broth, try collagen, try those herbals. I'm telling you, I've seen it work so well with my patients. But the Morinda, which is the Noni, the Malia, or the Golden Thread have all been showing in my practice to clear out the SIBO so well. So we have that. We have a few suggestions there, eliminations of things in your diet, and also getting rid of the emotions. So this may sound simple, guys, but at times with this supplementation, I've actually added another one in. So sometimes I'll have people on Morinda, and then I'll add in Golden Thread. These things have been shown and clinically have been shown to help. Look on the website, see if you have any extra information that you can glean from it, and send me any information if you learn something new. But I wanted to keep it simple and plain because that's how I operate in the office. You will see in the office that I just try a few things and try it very simply. Okay, guys? Don't make it crazy. Don't make it too complicated. The last part of this is probiotics. Everybody asks me, should we put more probiotics in there? If you have an overgrowth of too many bad bacteria, putting a good probiotic can help, but putting a ton of probiotics in there can actually cause a big war in your gut. That's why you can have bloating and gas, too much methane or hydrogen gas produced, which can cause diarrhea or constipation. So what I suggest is get a Viome test, a microbiome test. You can get one from Genova Diagnostics or Viome, V-I-O-M-E. Check it out on the web. Get your gut checked out. See which bacteria you may be deficient in. Start incorporating 1 or 2 single probiotics strands in your gut at a time. Build up. Then do the herbals. And then you do the elimination and get rid of the emotions, and you'll find out that you can start getting rid of SIBO quicker. Guys, these are simple steps, but I promise you they work. We're going to put on a webinar here soon in a few weeks. Guys, I hope it's going to work about gut health. I'm going to go over all these things with you and then show you on a patient how I operate. If you guys are interested in that, please send me messages saying you're wanting to see this, and I can send you a form to be like an information or contact form so that when this webinar goes out, I can hit you up with a text or with an email really quickly. All right, guys, I hope you guys are having a good day, and I want to keep in contact with you. See you later from the solar panels and the desert out here in New Mexico. I love y'all. Take it easy, guys. Check out the post. Talk soon.